let's bring you up to speed with the numbers. And India's COVID graph continued to show a declining trend with 1.73 lakh new COVID cases recorded in the past 24 hours, the lowest daily spike in 45 days. Earlier in the month, the country's daily cases had hit a grim world record of 4.14 infections, and this is now several days that we've seen the number fall below 2 lakh as well. The positivity rate also nearing about 8% or so. And Delhi also continues to show a dip over there. But let's again go back to Sukirti and get a sense on the numbers over here. Sukirti, when we look at these figures, it's very important, as we keep saying, to look at it in a sense of relativity, right? When we look at it in sense of relativity, that at one point, not very long ago, we were over 4 lakh cases. Now we are below 2 lakh cases. So it's a good moment, really. But even at this point, these numbers are too big and these numbers need to be handled. This is not the time when people can let down their guard.
Well, absolutely, Sonal. And even at this point of time, our positivity rate is 8%. Now, to look at the brighter side of it, it's the 6th consecutive day that our positivity rate has been less than 10%. But if you look at the ideal scenarios, something that the World Health Organization suggests is that any country's positivity rate should remain less than 5% for things to be able to be in a situation where you can say that things have become slightly normal, or the governments will find it slightly easier to handle things. So that benchmark is yet to be achieved. So positivity rate of about 8% right now. What we should be ideally trying to achieve is about 5%. And also the death figures. Today again 3,460 deaths. Now one might raise the question that if we are registering anywhere between 1 to 1.5 lakh cases, then why the death numbers are so high? Those continue to be high because many of these people who are dying now have been in hospitals for at least the last 15 to 20 days. There are people who've been on ICUs or on ventilators for anywhere between 10 to 20 days. That is what any expert who's been handling an ICU would be able to tell you anywhere in India. That's what they've been saying, that this time the number of critical patients is extremely high. We are seeing even young age group patients battling in the ICUs and ventilators for a very long period of time as we try to struggle with that battle of trying to save their lives. So these are many people who got infected during the peak of the crisis. So that decline in death numbers may happen only 2 to 3 weeks from now, because it will be a result of the people who are getting hospitalized or are getting infected now at this point of time and may not have as critical symptoms, or may get hospitalized on time and discharged on time. So all of those factors, a decline in death numbers may be witnessed only in the next 2 to 3 weeks. But definitely we still need to keep our guard up, because our death numbers are high and our positivity rate is also not up to the benchmark.